Welcome back to Can You Hear Me, a podcast about hearing, hearing loss, and everything in between. I'm here today with Dr. Aaron Moberly, Associate Professor in the Departments of Otolaryngology and Hearing and Speech and Sciences at Vanderbilt University. Dr. Moberly's research has investigated many aspects of adult otology and neurotology, but he has a special interest and focus on cochlear implants. Dr. Moberly, thank you so much for joining me today.
Sure, happy to be here.
Yeah, of course, and I'm happy to have you on as well. So we'll just jump straight into it. My first question for you is, can you tell me a little bit about what got you interested in ENT medicine?
Sure. I think my initial interaction was kind of typical, during first year of medical school. Really enjoyed head and neck anatomy, enjoyed sort of the meticulous, intricate nature of doing the head and neck dissections. And then actually between my first and second year of medical school, I spent a summer doing work in a laboratory looking at pediatric cochlear implant outcomes and language development. And so that experience, that was the first time I went in the OR, got to experience a cochlear implant, see what that looked like. And really that sort of opened up my interest into the field as a junior medical student.
I see. So that kind of experience in your medical school, was that when you started to see more of an interest in cochlear implants, or was it afterwards? I mean, I'm just curious.
Yeah, it was a mixture. I mean, that was my first experience with patients with cochlear implants. That was a pediatric language development lab, but really got much more interested when I started working more directly with adults with cochlear implants during residency and then fellowship. And that's where I kind of started to build my own research questions and direction, really examining factors that contribute to variability in outcomes in adults who get cochlear implants.
Yes, and I'm really glad you mentioned that because one of your studies is actually titled The Enigma of Poor Performance by Adults with Cochlear Implants. And you really, in that study, you talk about the current knowledge of poor cochlear implant performance. And I'm really curious, can you tell me, what kind of sparked this study and how current knowledge has changed since 2016 when the study was published? So how has our understanding of the poor outcomes of patients who receive cochlear implants changed in the last 10 years? And where do you foresee this going?
Yeah, so it's been an interesting direction. I think in some ways it's advanced quite a bit, in other ways not very much at all. So sort of the premise of that paper is actually maybe a little bit more of a review paper that included some of our work and other people's work. And the bottom line was that there's a lot of different factors that contribute to how well people do with an implant, including poor performance. And so I think since then there's been a decent bit of work that has further investigated some of the factors like the electrode neuron interface and sort of the signal quality that comes through a cochlear implant, and some different types of objective measures that help us to quantify that. My lab has continued to focus a bit more on sort of the cognitive and language side of things. So what sort of language and cognitive skills does that listener bring to the table when they get a cochlear implant? And all these things together play roles in how well people do with cochlear implants. I think a couple newer directions. One is that there's been a lot of excitement about applications of artificial intelligence. So not just in how these devices process signals, but really can we use AI to help model outcomes better? And that's true to a degree, but the factors that we still look at in predicting or explaining outcomes, even if you use more sophisticated modeling approaches, they're still limited by the types of measures you can put into those models. So that's one thing. Another direction is really expanding out from just worrying about how well people can understand speech with a cochlear implant. So back when I started, that was really the focus was, can we understand variability in speech perception, which we use as sort of our main clinical measures of outcomes. But really, I think there's been a much broader emphasis on looking at more comprehensively at the whole patient. So looking at patient-reported outcomes, quality of life, things like fatigue, device satisfaction. These things are playing a much bigger role sort of in the work that our lab and other groups are doing. So defining a poor performer or poor performance or poor outcome as just a poor speech perception score really doesn't make a lot of sense anymore. So I think those are some of the directions that the field has kind of moved in the last 10 years.
I see, I see. So more holistic view of the patient in terms of defining success for a
Yeah,
cochlear.
absolutely. I think so.
Okay, yeah, that makes sense. So besides this kind of, outcome measures, are there any other works that you do with cochlear implants? And I mean, why should patients really care about these kinds of things?
Yeah, I mean, I think one of the things that's really important that's also evolved over the last decade is who are we talking about cochlear implants to? So it used to be, even when I started as a resident, these people had to have pretty bad hearing in both ears before we would really consider them candidates for a cochlear implant. And now the field has really expanded out to looking at people who have, one bad ear and one less bad ear, or one bad ear and even one perfectly normal ear. So that's called single-sided deafness. This has become a very hot topic, and it's really expanded out access to a broader population of patients who could benefit from cochlear implants. Some of our future work and work we're starting is really looking into some of these outcome differences in those populations. But I think that it's very important for the field and for patients and practitioners to realize that we're not just talking about people that have really bad hearing in both ears anymore. We're talking about a much broader array of patients who may benefit from cochlear implants.
I see, I see. So I know we've kind of talked a lot about the work that has been done in the past and what's going on right now, but is there anything you are looking forward to in the field of cochlear implant outcomes or just otolaryngology in general? I mean, I know you mentioned using AI models to account for outcomes, but is there, you know, more in that you're excited for, or is there something else? I mean, I'm just curious to know.
Yeah, I mean, certainly AI is a really hot topic, but a different direction that I think is very exciting. And there's been a lot of new work in the past couple of years is the applications of gene therapy. So, back when I was even going through fellowship, I thought, this is 50 years off. And there are very specific instances now where gene therapy can be applied for patients with hearing loss. It's a very sub niche of patients so far, but the proof of concept is there. And so if there are additional advances made in other forms of hearing loss that are related to genetic causes, that may be something that's going to continue to build over the next few decades. And one interesting factor that may be come along the way is sort of the combination of devices. So maybe gene therapy plus a cochlear implant may lead to better functioning and hearing abilities of patients. So even if you can't completely restore hearing in someone through a genetic treatment, maybe you could do some of that plus an electrical device or some sort of implant device like a cochlear implant may lead to some sort of interesting patient outcomes, but also very interesting research that can come out of that is how do people combine these different types of signals that are coming through their ears. So I think there's a lot of exciting directions as we start thinking about the application of genetic therapy, but also continuing to use some of these more established treatments like cochlear implants.
Yeah, I mean, I've heard a ton about gene therapy. I mean, it seems like the hottest new thing in the field because it seems like, the eventual goal is so that patients can use their own ear to hear, basically, with no need for any kind of hearing aid or a external device, if that makes sense.
Yeah, absolutely. And, I mean, I think if it is able to restore some or all of someone's natural hearing, we know that patients don't necessarily love the sound that comes through a cochlear implant.
Mhm.
They tend to adapt to it over time, but there's still limitations that these devices can't overcome based on how they function.
Yeah.
So if you can restore some degree of acoustic hearing through that sort of intervention, that would be an amazing progress or step forward in the field.
Yes, yes, definitely. Well, thank you very much for joining me today, Dr. Moberly. It's been amazing to have you on the podcast.
Absolutely. Happy to be here. Thanks for inviting me.
Yep, thank you.